Hi, my name is Jaden and welcome to Living with CCI. CCI stands for Craniocervical Instability. The reason I'm making these videos is because I was diagnosed with CCI late last year in 2022. It's now 2023 and I'm just kind of going back through my history and my story because I wanted to get it out there. I feel like there's not enough resources of what it's like to live with CCI. There's a lot available on the different treatments that are available, and a little bit about the diagnosis and how to get one. And there are it's a difficult condition to have because it's not acknowledged by very many doctors at all. And when you do finally find treatment, it's really expensive and it's generally not covered by any insurance, or if it is, it's like out of network. And so I've talked in other videos, I've talked a lot about the regenerative medicine treatments for CCI, of which I've done everything there is, which they were expensive and didn't really help me in the end, but they were worth a shot, and I still believe, I don't regret doing them. I had sort of ended off with having 2 PICLs, which is probably, PICL is offered in Denver. It's a stem cell procedure that treats the ligaments that cause CCI when those ligaments are loose or damaged. So I had that procedure twice and it didn't work, and I had some prolotherapy and I had some basic PRP. So I've been through that. I'd also done other treatments. I had seen a neurologist and did sort of headache stuff. I had radiofrequency ablations from pain management people. I had some nerve blocks. I tried all the different flavors of chiropractic that's targeted at the upper neck, and a whole bunch of other things that I went through because it's hard to live with CCI, and I mean that's why I'm making this video. Anyway, so the purpose of this video is I want to talk about diagnosis of CCI, which is really hard to get. And then, in talking about that, I basically talk about my experience dealing with the mainstream neurosurgery world and sort of the things to look out for and for people that are exploring that. So I'll just start off. I've had symptoms for about 10 years. They were quite manageable in the beginning. About 5 years ago, I realized hey, this is a serious problem, and I got my first MRI. And with that MRI, I was told by the doctor who ordered it to go see a neurosurgeon and make sure that everything's okay. The radiology report, of course, found nothing because, again, CCI is it's so hard to diagnose. It's just so uncommon and very hard for to be seen in the imaging, especially static imaging, just like regular supine MRI. So I went in with this pretty clean radiology report and pretty clean MRI and saw a neurosurgeon, and he was kind of there's nothing to fix. What are you doing here? And he sent me to physical therapy to deal with my symptoms. So, I mean, that was kind of my first experience. It felt like a huge waste of money and a little bit embarrassing, I guess, to be treated that way. But, nonetheless, I knew when I went to see him in 2018, I was I'm not going to be getting a surgery, but I wanted some help, and neurosurgeons, I guess the first point I would make is they're very, they put a lot of weight or emphasis on imaging. So if you don't have anything in your imaging, they're not very interested in helping you. And because of that, because CCI is very difficult to detect in any conventional imaging, you're not likely to find in any city, anywhere, a neurosurgeon that's going to see it. That's oh, you have, this is what's going on. This is what's causing your symptoms. So you're going to get a lot of neurosurgeons looking at your MRIs or CTs or whatever, and sort of being well, there's nothing here for me to treat, just because they can't see it in the imaging. it would be nice if they took a little more consideration into your history and your symptoms, and they were a little bit more, they were willing to do a bit more detective work, to try and get you a diagnosis, but that's not really the case. So that's just something to be aware of if you're going to be spending a lot of money on consults with neurosurgeons. Okay, that was my first experience, and that's like 5 years ago. So I kind of gave up on neurosurgery after that, thinking that they're not going to take me seriously, and I'm not bad enough to be getting a surgery. There is a surgery available for CCI. It's a very major surgery, and some people need it because their lives are so, their quality of life is so poor that the surgery will at least give them some improvement. In my case, my symptoms are, they're not fun, but I have headaches, neck pain, muscle pain, a heavy head. It's hard to hold the head up, and I get occipital neuralgia as well, which is one of the more annoying ones because it triggers headaches, and it just gives it's nerve pain in the back of the head. So basically, when I decided to sort of become interested in the neurosurgery stuff again was after I'd been through all of the treatment. I did, the 2 PICLs and failed that treatment, and I just didn't have a lot of options, and I was kind of at this end of the road. I'd been written off by the regenerative medicine clinics that they just couldn't help me. They couldn't treat my CCI. So I was sort of like flailing of like, what do I do? What do I do next? Do I just give up? And I was thinking that one of the things I wanted, I guess, to have some closure, is I really wanted a written diagnosis. So one of the reasons I sought out neurosurgery was that they seem to be the people who will give you a diagnosis of craniocervical instability. You'd think that the doctors before that regenerative med and pain management people would do it, but they did, try to get it in writing. They seem very reluctant to put their name with a CCI diagnosis, and I'm not sure why. I asked for letters and things that I could show my employer to get accommodations and potentially have. I mean, just for my own like insurance or government or whatever. I wanted to have something that's saying this is what the guy has, and I know what I'm doing, and so I've diagnosed him with this. But it's really hard to get that. So I was aware that there's a small, I'm talking very small group of neurosurgeons in the world who perform CCI surgeries. I believe there's 4 or 5 in the US and 1 in Europe. And so those are the people who will give you the diagnosis because, of course, in order to get a surgery, they have to be willing to give you the diagnosis to justify the surgery. And so I really thought after I'd failed regenerative medicine and, I just had really nothing left to do, I was like, okay, well, maybe I should put some time and money into seeing these surgeons. To get the diagnosis, if in fact they agree, and B, so that I had that option. I mean, if my condition worsened or I just really couldn't live with it anymore, then I had the relationship established with a surgeon who could do the fusion on me. So anyway, so I started, and you can find these, if you're on the Facebook groups, any of them. I mean, you'll figure out pretty quickly who these surgeons are. So I'm not gonna put names. I don't want this video to be about names of doctors and stuff. So go on the Facebook groups, and it'll be apparent to you if you look around for a few hours, who these doctors are. So I basically said, okay, I'm gonna make some appointments with these world class CCI neurosurgeons. But it was a long wait. they're actually one of them who is one of the more popular ones. I think because he might take insurance or something, like, which would be like the only one of all of them. But yeah, I'm still on a waiting list to this day. And at the last time I called them, they're like, oh yeah, like maybe by 2025 or something, we'll be able to have you for a consult. So it's like, okay, well, and I got my name in with a couple others, and it was kind of the same, like, message in a bottle, like, get some imaging and send it off and so on. So one of the things I did, like, that while I was getting imaging and I was kind of just idling, and I thought, okay, what if I could find somebody local? I live in Los Angeles. I mean, it's an area of 10 million people. So if I could find a neurosurgeon here who knew something about the upper neck, there's got to be a neurosurgeon in this area that fuses, C1-2 at the least, or maybe even the full CCI fusion. There has to be. So I looked at that as well, and just to try to, find somebody on my own, like, irrespective of the people that recommended on Facebook. And well, here's the story, because like, if anyone, basically I did find somebody who, I had gone through sort of journal, like, published articles, and I looked for people that were involved in, C1-2 fusions, because that's more common than the occipital fusion, to, like, the head to the neck. So I found, like, this doctor, and it turned out he was only about like 3 miles away at the Cedars Hospital in LA. So he's like pretty much like one of the top neurosurgeons in the city. And he, has his name attached to a lot of research and stuff on C1-2 fusions. And C1-2 would be, along the lines of the kind of surgery you'd get if you had CCI. And so I was thinking, okay, well, this guy, it's probably worth my, $500 or whatever to get the consult, maybe get him to order some imaging, and then hopefully, like, he can give me some advice and diagnosis and whatever, and be an option if I wanted to get a surgery at some point. So I went in and saw this guy. It was very easy to get in. He's out of network, so, like, I got in within a couple weeks. And, it was $500 cash or whatever. So it was like, okay, fine. Like, at least I can see him right away. So yeah, I went in there, and he had my, I already had imaging from, other people that had ordered imaging. So I sort of brought all my imaging, and I had this stack of CDs. I mean, all of you, like, other people listening are probably like, oh, I've got my stack too. Like, which one do you want, doc? So I had all these different images, and I went for the appointment, and I could tell, he really, he had me stand up next to him, and while he sort of looked through these images, and he was very quiet. It was interesting. Like, I'm like, oh, he's really thinking about this. He asked a little bit about my symptoms and, like, other treatment I'd done. He wasn't aware of the PICL at all. Like, he's like, oh, that sounds like crazy or whatever. Like, so he wasn't really literate as far as, like, what people are doing to get treated for CCI. But, he's like, yeah, like, we don't know about stem cells, and, like, there's a little bit of stuff that's funded by NIH, but it's still, like, be proven or whatever. So yeah, I mean, he was kind of, like, open-minded about it, but yeah, he was not aware of, all of the treatment that's going on for people with conditions like I have. And but yeah, he sort of listened a little bit and showed me the images, and he said, yeah, like, you do have more space in the, I guess in between the dens and the front of the atlas or C1 vertebrae. He's like, yeah, that's like, it's a little bit more than usual. And I don't know, it was all very vague. And, but yeah, so he didn't write me off, but he's like, yeah, there's no fracture. There's no, to him, in his view, like, there's no way he would do a surgery on me. And he certainly didn't, he didn't think that I had CCI. And I mean, I don't even think he believed in CCI as being a thing. Like, I do remember something he specifically said. He said that he didn't believe that there was anybody, any neurosurgeon like in the world, that really understood what was meant by minor instabilities in the upper neck, like between between the head and C2. So there were two things in that like he did acknowledge that there was some kind of mysterious, condition where people had these very minor instabilities at the, on the top of the neck that were really hard to see in the imaging. But what he didn't agree that anyone sort of knew what the tolerances were, like how much is too much, or, what causes symptoms and what doesn't cause symptoms. And so he basically just said, like, nobody knows anything about this, but we know that, like, some people sort of have more, more movement up there. And so that's kind of, I don't know. He gave me kind of a half-assed, like, credibility, I guess, for complaining about all this, right? And so I was like, okay, fine. Like, okay, this appointment's over. And he's like, well, if you're interested, I'll order a SPECT CT. And I sort of perked up. I was like, oh, like I haven't had that. And he said that I think it's kind of an older technique. The doctor was also pretty old himself. But it's a nuclear medicine scan. And I think I'm going to make the image the thumbnail of the video. But it's basically where they inject you with an isotope, and the molecules of the nuclear stuff are absorbed by healthy cells. And so the only, like, you get injected and they do this at like a special medical imaging place. So you get the injection, and then you come back in like 2 hours. And, if everything is healthy, it's supposed to absorb, like your body will absorb all of the isotope. And so then they scan you for the radiation. And if anything is still there, it means like there's some damage to the tissue or the bone or whatever. So he said he uses it to determine like how bad people's arthritis is, or how much degeneration they have in their, in their spinal vertebrae and whatnot. So I was like, okay, well, that sounds like, I was kind of thinking, well, like maybe my C1-2 area will just be like bright red, and like then he'll be like, whoa, this is like maybe he would show some interest in my case. And so yeah, I signed up for this SPECT CT, and so the CT part is actually in addition to the nuclear scan, they do like a regular CT, and then they use a computer software to like overlap them. So you get the CT is like really good resolution of all the bones and the structures in the neck, and then they will match it up with your nuclear response after you've had this injection. So yeah, I had this scan. It felt a little weird going into this room with the biohazard symbols and all that stuff, but yeah, they give me the injection, and then I didn't feel anything. Just like went for this walk for a couple hours around Santa Monica where the place was, being radioactive as I was. So, and then I went back and they did the scans, and that was it. And so then about a month later, I got brought back to the neurosurgeon, and I'm like, okay, like what's the news? Like what is, what came out of this imaging? And he brought it up, and it was the same old stuff. It was like there was basically nothing in the upper neck. It was all clear. And so the only like radioactive tracer is what they call it. The only sort of stuff left was lower down in the neck, where I've had some disc degeneration, and I've known about that. It that's not causing my symptoms. I've had nerve blocks, and I just don't have symptoms from the C5-6 level. Like those would be down my arms and stuff, not in the back of my head. So yeah, so this friggin' $2,000 nuclear imaging scan is basically just telling me more of the same. Like it's just not sensitive to the upper spine, or I didn't have a problem with the upper spine, which would have been the surgeon's perspective, right? Like you're just imagining it or something. But anyways, so I just was like, I really thought like, yeah, I'm kind of an idiot. Like, I should have known not to just see like any neurosurgeon, like no matter how good he is. I mean, because so lesson learned, like for everyone watching, is like just don't. If you really have the certainly if you've had like PACLs and stuff and they've diagnosed you essentially, don't bother with regular neurosurgeons because if they can't see it in the imaging, they just won't be able to help you. And that's until there's more education and awareness of CCI. And as this guy alluded to, that like they knew that like having some minor instabilities was a thing, but they just didn't know how to deal with it or like whether to consider it a problem or not. So I went through all this and didn't really end up, like, he just sort of said like, well, you could try to treat the occipital neuralgia. And I'm like, yeah, okay, I've done that. I've done the neurology stuff. And so that chapter kind of closed. And then by that time I had started to get some consults set up with the actual CCI neurosurgeons that were in a position to help me or at least diagnose me. And the first one I had was actually with the surgeon in Europe. And so that I got that appointment. I had to get some additional imaging for him. He needed an upright MRI where you're seated and your weight bearing MRI. And I also had to do the flexion, extension, and rotation for that one. So it was I had to spend some money on that too. So I got that in, and I saw him use over a video visit, and I was pretty happy with the appointment. It was, I think he gave me about 20 minutes, which for somebody, like for a neurosurgeon in general, but for like a guy like in demand as much as he would be, I was impressed to get 20 minutes and to be able to have some time to ask questions and follow-up questions to the answers he gave me. And so I liked it, and I don't remember exactly what I paid, but it was more than $500. But it's like this guy's like one of the few experts. And so basically that appointment, he said, yeah, okay, I've looked at all your stuff, and he didn't really say much, and then he just said like, what are your questions? Like, what do you want from me? And I said, okay, well, I want a diagnosis. That's number one thing. And he said, okay, yeah, like you have craniocervical instability and you have atlantoaxial instability, based on the criteria that's agreed upon by a group of neurosurgeons that work in this area in the Chiari malformation kind of group. So basically, Chiari is another kind of related condition in the neck. It's actually to do with the part of the brain and the top of the cervical spine. There's sort of a group of neurosurgeons that work in the craniocervical area, and they've collectively come up with these imaging standards and values where they can evaluate people for craniocervical instability. So what you need is to get a surgeon that operates within that body of knowledge, that will know how to properly measure your MRI. Like, you're never going to get this from a radiologist or whatever. And it's true. Like the radiology report that I got, didn't have anything about CCI, and it wasn't until it went to this neurosurgeon in Europe that he said, yeah, you meet the criteria for CCI. So yeah, I guess happy about that. I mean, it's like, I know you shouldn't really be happy to have a medical, condition or whatever, but it's like, I just wanted to know, like, is this actually what's, is this, do I actually have CCI? I just wanted to know. Some people might be upset with me for like taking up appointment time or whatever, but like, I wanted to know. And so I decided to pursue that. And then, we talked a little bit about, the surgery, and he really said, like, if you're working, like, there's no way really that I would, recommend or be willing to do a surgery. So that's something to keep in mind for other people that are going down this road. Like, if you're working, if you're employed, it seems like that's a big factor for the surgeons, because not only the European guy, but one of the ones from the States that I did a consult with was the first question. Both of them was the first question that they asked. Are you working? And if you say yes, then I guess it significantly decreases their willingness to consider you for surgery. And of course, he told me that most of his patients are bedbound, and so he's willing to, entertain the idea of like a surgery that, they're still going to end up with problems, but at least like they'll have more quality of life than just sort of being in bed and not being able to function. So yeah, in my case, like I'm pretty high functioning, and so ultimately didn't recommend surgery. And then the U.S. one is a bit different. So you kind of submit all your stuff. There's a questionnaire and imaging, and then you don't get a consult. You don't get a video visit or in person. Like you get an opinion. You get a written opinion from him. And so I was kind of like, okay, well, this it was cheaper. I think it was only $300. So I thought, okay, well, like if he's willing to offer this and to look at everything and give me an opinion, like I think it's worth doing. And so I pursued that, and it took a really long time to actually get the document back. I think it was like, it wasn't a year, but it was many, many months. But yeah, so I finally did get that one back as well. And it also said that in his case, I think he said it was like a strongly suspect that it's CCI, and he his position was the only way to definitively diagnose, like, so there's no question, is to do a invasive traction test, where they will actually put, bolts in your skull, and they'll, pull up on it. And so that's, I'd heard that was the likely, that's how he sort of does things. And I think it's a good thing. I mean, if you're going to get a surgery that's that significant, you want to know, like, what's it going to be like when you're fused. And so the traction test, I think it's diagnostic to make sure that, they're doing the right thing. And then it's also to kind of give you a little bit of a preview, maybe, of like, this is, is this what you want? Because this could be permanent, right? So, so I got the letter. I got basically offered to go out and do a traction test, if I wanted to, and this sort of wording that, is very, very strongly, believes that I have CCI. So yeah, those are the two experiences. I'm still on the waiting list for that other one. That's, may one day have time for me. And I didn't pursue any of the other surgeons. I just sort of thought, like, okay, two to three is, like, I think that's enough. I don't need to, like, be too greedy about surgeons' time. So I just sort of picked the ones that I thought were the best fit for me. So yeah, I guess I think that's like how I want to wrap this one up. So just a little bit of information is I'll end this off by saying I did actually get a surgery, and it was as a result of information that I got from these consults. So in the next episode, I'm going to talk about the surgery I got. It was not a fusion surgery, but it was a simpler surgery that would help address my nerve issues. And it was recommended by the European neurosurgeon. So without his kind of giving me the idea, I don't think I would have known to go looking for it. So yeah, I want to talk about that, I think, in the next video. So I think that's a good place to leave it. This one will be finally like a little bit shorter. I've been doing these hour-long podcasts or videos. So basically, I mean, I think if you're out there and you're trying to get a diagnosis, make sure that you're going to one of the select few neurosurgeons that will believe in that know what they're doing as far as CCI goes, that can rule you in or out based on measurements. You have to see those people. Otherwise, you're just going to get neurosurgeons that don't see anything in your imaging and think you're crazy or what. I mean, they probably don't think you're crazy, but maybe they kind of do. I don't know. See one of the recommended CCI neurosurgeons, also really think about, like, if you're like me and you're just fed up and frustrated about CCI, like getting the fusion. I mean, it's tempting. I can't deny, like, I've thought like maybe I should just get a fusion, but I think it's I think there's still a lot we can do. Some of us, like, I mean, some people need the fusion, but I think there's still a lot we can do to adapt to the symptoms and treat the symptoms with medication and physical therapy for some people if you benefit from that, and just adapting your how you work and how you live. And and I want to talk about that I'm going to get there. I keep saying that's the whole point of this series, but I want to talk about kind of adapting to CCI as well. So anyways, I'm going to leave it there. So the next one, which will be hopefully another shorter one like this, you'll get to hear the story of my surgery, and what it was, and what it's done for me, and and so that I look forward to telling that story. I just had that surgery a few months ago, at the end of last year, and I'm still kind of, I guess I'm recovered from it, but I mean, I'm still a little bit on the mend from it. So yeah, we'll talk to y'all next time. Thanks for listening. Please like the video. It will help other people to discover it in the YouTube world. And if you have comments, or if you want to share stories about your dealings with neurosurgeons, please leave your comments, and we'll talk to you next time. Bye.